paper-based EVM tool to a mobile-based tool is a simple yet effective innovation.
One of the key priorities of UNICEF Assam is to contribute towards health system strengthening. In this context, there is a critical need to gain insight of the status of health infrastructure, human resources, and the actual uptake of health services by the intended communities through regular monitoring and supervision. Data collection through paper-based systems have inherent challenges which can be addressed effectively by the use of technology. UNICEF has actively leveraged mobile-based technologies to quickly gather inputs in real time from the field and make it widely available through dashboards. This assists policymakers and implementers to make informed decisions. UNICEF, in collaboration with the Department of Medical Education Assam, has successfully deployed the mobile-based technologies for supportive supervision of routine immunization and reproductive, maternal, neonatal, child health, and adolescent interventions across the state.
মোবাইলৰ দ্বাৰা আমি এতিয়া এফেক্টিভ ভ্যাকচিন মেনেজমেন্ট আমি কৰি আছো। ইয়াৰ পৰা আমি বহুত লাভ হৈছে এই কাৰণে যে আমি ডাইৰেক্টলি আমাৰ এএনএম সকলৰ লগত আমি যোগাযোগ কৰিব পাৰিছো আৰু ভৱিষ্যতে কৰিম। মিছন ইন্দ্ৰধনুষ এতিয়া বৰ্তমান চলি আছে। এই মিছন ইন্দ্ৰধনুষ আমি এই মোবাইল ব্যৱহাৰ কৰি এফেক্টিভ ভ্যাকচিন মেনেজমেন্ট আমি আগবঢ়াই লৈ যাবলৈ ভৱিষ্যতেও আমি প্ল্যান কৰিম।
The technology solution was conceived as a three-stage process: collect, collate, and share. At the collect stage, an Android-based application was designed to enable data monitors from the field to collect information at the cold chain point and other delivery points. The data, once collected from multiple points, was then collated at the server using an engine wherein there were options to validate the data and clean it. Once the data was cleaned, it was applied with a rule-based engine to compute the scores and generate the statistics that will enable policymakers to make evidence-based decisions. The computed variables were then pushed to a DevInfo database, which is a UN-endorsed platform which is available royalty-free. From the DevInfo database, there were three types of dissemination that was followed. It was disseminated via a DevInfo user interface as well as a dashboard which showed the key GPS locations and the particular score for a facility. Besides, a one-page fact sheet was also generated from the data to enable a quick analysis and sharing of the data.
As it is known that effective vaccine management, also known as EVM, is setting up of the minimum standards for cold chain and vaccine logistic management. It is done with the objectives of identifying the best practices and strengths, gaps in the knowledge of the vaccine and logistic manager, cold chain technician, resource requirement, and scope of capacity building. Basically, 9 criteria are there for conducting the EVM assessment. One is the vaccine arrival procedure, then vaccine storage temperature, then cold and dry storage capacity, stock maintenance, distribution of stock, then vaccine management, and the MIS and supportive functions. The EVM assessment was done in Assam in all the districts, which included a state vaccine store, 4 regional vaccine stores, 27 district vaccine stores, and 54 sub-district vaccine stores.
Let's see how the app actually works. The mobile application has been adapted from the ODK toolkit. To navigate, users simply have to swipe the face of the mobile, and to input data they simply need to tap the relevant options. The forms can be customized to enable data input as radio buttons, multiple checklists, numeric as well as text fields. Besides quantitative data, the system also enables users to capture qualitative information such as pictures, videos, as well as the geographic locations. The navigation also enables users to view all the questions at the same time or to quickly browse and jump to a relevant question.
We kept the scalability and sustainability of the project in mind right from the beginning. We ensured endorsement of the key government stakeholders such as the Director of Health Services, Family Welfare, the Director of Medical Education and the Mission Director National Health Mission. UNICEF supported consultants at the state and district level were trained along with the medical college personnel in mobile-based supportive supervision. The routine immunization and RMNCH+A supportive supervision is being implemented across all the 27 districts of Assam, and within a span of 5 months, we have been able to cover more than 500 health institutions, which include both the cold chain points as well as delivery points, out of the 800 facilities which had to be covered.
Directorate of Medical Education, Research and Training, DMERT, Government of Assam, is one of the most important and strong pillars of the health department. DMERT has entered into a partnership with UNICEF for strengthening the routine immunization in the state, which is one of the most cost-effective interventions for reducing child morbidity and mortality. The community medicine departments, the faculty and the postgraduate students of all the 6 medical colleges of the state are actively involved in the supportive supervision activity of routine immunization and also RMNCHA, and in the effective vaccine management assessment also. UNICEF has played a very critical role in using mobile technology for supportive supervision, which has multiple advantages and is the need of the hour. With the Government of India's focus on using digital technology, I feel that using mobile phone for monitoring in real time can be a game changer in strengthening the health system, and Assam has shown the way forward for other states to use this technology and replicate the model.